upward, upward until I reaching what? I reaching the bicipital tendon. Now if I open the color Doppler, should be within, just with, behind the biceps tendon. The long head, just easy with the scale. Pulsating vessel should be appear here by power Doppler because this one. This is the humeral circumflex artery. You see this is bicipital tendon. I am now perpendicular on it. I'm now perpendicular on this muscle. If I just make tilting, what this muscle appear tendon? Appear black. So sometimes doctor say that it is complete rupture. Someone say that is a fusion. But this is anisotropy artifact. So should be my probe perpendicular to the muscle. This is the muscle. Should be perpendicular to it. This is the laser and the greater tuberosity. And now a new muscle appear medially. If you see, this is a new muscle start to appear medially, which is the only muscle that inserted into the laser tuberosity. This is the subscapularis muscle. Subscapularis muscle. Now I go more medial to the coracoid process to examine it. So I go now medially till I reach the coracoid process. The white line is the coracoid process. This is the coracoid process. Below this coracoid is subscapularis muscle. Just above this subscapularis muscle is the coracohumeral ligament, this white line. So by subjectively, it is normal, within normal thickness, no hypoechogenicity, no fluid collection. So it is appear normal. So any white line that appear just above the subscapularis muscle is the coracohumeral ligament. Now I want to do examination of subscapularis muscle. Its action is internal rotation. So I do against its action. I do external rotation. Patient to do internal and external rotation. This movement is internal rotation. This movement is external rotation. So I do now examination of subscapularis muscle. You see this muscle comes out. Now this muscle comes below the coracoid process. This subscapularis muscle. How to examine it? Do action against its normal action. External rotation, the subscapularis comes outside the coracoid. Now internal, you see, this muscle comes below the coracoid process. And the laser tubercle comes beside the coracoid process. So, now, this is the home page. Continue upward, upward, upward until see the biceps tendon. Examine the biceps longitudinally. Open it longitudinally. This is the biceps tendon. Now I continue medially till I reach the coracoid process. This white line. This white line is coracoid process. This is the subscapularis muscle. This is the coracohumeral ligament. Doing exam of subscapularis. By ask the patient, this subscapularis, ask the patient to do internal and external rotation. So now this muscle comes out, this muscle comes in. So this is called subscapularis muscle impingement. Subscapularis muscle impingement. At which time we should consider this impingement test is positive. Ask the patient if there is pain, so it is positive. أي ألم تحس بيه؟ So impingement test now is negative. What to examine now? This is the coracoid process. Coracoid process give one muscle medially, origin of one muscle medially, but we see just it as tendon. This is pectoralis minor muscle. This coracoid process, the muscle tendon that comes from medial side, this is pectoralis minor muscle. From lateral side, give two tendon. You see, it is just small tendons. First anterior one is the coracobrachialis, and the below one is the short head of biceps muscle. So now we examine the subscapularis, long head of biceps, deltoid muscle. Every muscle appear anteriorly is the deltoid muscle. Now go to examine the ligament to complete the anterior compartment. So first ligament we see is the coracohumeral that comes from the coracoid process toward the humerus. From the coracoid process toward the humerus, just above the subscapularis muscle. This is the first ligament should be examined. Another ligament, this is the coracoid process. I put my probe transverse on it. Then the right side of the probe, make it cranially toward the clavicle at the lateral side. At the lateral side. So this clavicle will be appear. Now this is coracoid process. This is the clavicle. The ligament white line, that line between it, and it is laterally. This is the trapezoid part of coracoclavicular ligament. Trapezoid part. Again, I put my probe on coracoid process. Then make the right side of the probe cranially toward the clavicle. Toward the clavicle. Now the clavicle will be appear. The white line, this is the clavicle. You see? This is the white line, shadow behind it is the clavicle. This is the coracoid. The white structure line between them is the lateral part of the coracoclavicular ligament, which is called a trapezoid part. Then also I go to it laterally. Then I do fanning of my cranial part toward the medial side. But I should see the clavicle now, okay? So I make it toward the medial side. You see? This is toward the medial side. Just make fanning. Now, so this is the medial part of the coracoclavicular ligament, which is called conoid part. This is important. So the blue line is the bone, the green one is the muscle. This muscle, sorry, this nerve that appear on the So you see this yellow rectangle or yellow box appear on nerve. Appear and go, appear and go. This is the lateral pectoral nerve, which is lie just above the medial part of the coracoclavicular ligament conoid part. So this is coracoid process, this is the clavicle, this the ligament medially, because I make fun on my probe medial. This is the conoid part of the coracoclavicular ligament. Here there will be a blood vessel. Blood vessel is a landmark for the nerve. Just beside it, there is a nerve. Because it is a small nerve, sometimes not appear. So when put your probe here and make radiofrequency ablation, because you make sensory and motor stimuli, This is the lateral pectoral nerve, anterior nerve supply of the shoulder joint, here. So, how to examine the coracoclavicular? First, I put my probe on the coracoid process. Then, the right side of the probe is fanning cranially toward the clavicle, until the clavicle will be appear. This is the lateral part, trapezoid part of coracoclavicular ligament. Then I make my probe fanning toward the medial side, towards the medial side. This is the coracoid, this is the clavicle. White line between them is conoid part. Just above it is the lateral pectoral nerve. Now, another to examine is coracoacromion ligament. So put my probe on the coracoid process. Then make the right side fanning toward the acromion. So it appears with a long distance. This is the acromion. It is with a long distance, not like the clavicle. The clavicle is nearby. You see, this is the clavicle nearby. But here, I make my probe fanning toward the acromion. This is coracoid process. This is the acromion. The white line between them is the coracoacromion ligament. Coracoacromion ligament. Another part should be examined in the anterior compartment in order not to forget it is the acromioclavicular joint or ligament. I just palpate the clavicle on the acromion and put my probe on it. You see this one. This is the clavicle, this is the acromion. This is the acromioclavicular joint. Here, a lot of clinical cases come with tenderness here. You do ultrasound, it is normal, no anything. But even though we can inject PRP or steroids, but the needle should become in a plane from here or from here, not exceed 2 milli, because supraspinatus muscle comes below this. Supraspinatus muscle comes below it. So now, complete the anterior compartment. Begin from the home page. Examination of deltoid, long head of biceps, pectoralis major muscle, then bicipital tendon. After that, go medial to examine subscapularis muscle and do impingement test of it. And then examination of the origin of small tendons from the coracoid process, then examination of ligament. The most important ligaments is the coracohumeral ligament. Other ligaments are acromioclavicular, coracoclavicular. Now go to the back side of the examination of the remnant of the rotator cuff muscle.